So I'm just going to kick off the afternoon session with a very short, succinct presentation about the work of the Innovation Agency, and also it represents the work of HSNs up and down the country. So there are 15 academic health science networks, of which we are one. And it feels appropriate to do this at this time because we've got a couple of HSNs presenting this afternoon about some work streams that they're involved in. So I'm just going to give you a broad overview and they'll drill down into some specific projects. So I said right at the beginning that this conference is really about how we influence culture to enable digital change, how we collaborate between sectors, between staff and residents to do that, and how we work with communities to get things right for them. So this is one of the areas we're working on at the Innovation Agency, and this is a culture change programme engaging our staff and engaging our residents. And the person you'll see on the screen is one of our clinicians. He's holding up a 3D printed heart, and as well as being a clinician at Liverpool Heart and Chest Hospital, he's also one of our Innovation Scouts. And Innovation Scouts are people we train in each organisation to be the go-to place for innovation. We train them in how do you think about new methods of working, how do you support a staff member who might be innovating on their own, how do you have a peer support network across the patch. So we're building up this cadre of people who are trained in innovative techniques. There are 70 scouts we've got registered. I would say probably about 25, 26 are fully active. A lot of that is because they have very busy day jobs, so they'll dip in and out, but we've probably got about 25, 26 people working across a region as innovation scouts. We also run a number of coaching programs, so you can go in a coaching program for safety, a coaching program for adoption and spread, coaching program around quality improvement, and we run specific sessions for commissioners about how they decide to select the innovations they're going to roll out. So it's no good having all this wonderful digital technology if commissioners aren't cited on it and don't buy it to be used in the service. The second area I'm going to talk about is collaboration. And the gentleman you'll see here on your right is Hassan. He's one of our community pharmacy leaders, and Hassan's involved in a number of projects, but one that we're rolling out across all academic health science networks is a project called Transferring Cares Around Medicines. So we saw the slide before lunch about the medications from one patient coming into hospital, and I heard a collective gasp in the room when we saw the number of medications. So the other problem is that when people are discharged from hospital, their medications might have changed, and sometimes they really don't know what to do or how to take those, or a record doesn't transfer to a GP. So this programme is using a digital system to scan records of patients who are being discharged and stratify them out so we can have a look at the patients we think maybe are quite vulnerable in terms of changing habits, taking new medications, and we link them to a community pharmacist. So they're linked to a community pharmacist who goes and visits them on discharge, talks them through how to take the meds, monitors them, and that has massively cut readmissions into hospital from medication errors with people taking the wrong meds when they're out of hospital. And if we think that 6% of hospital readmissions are down to people taking the wrong meds after discharge, this makes a really big difference to people's lives, but it also reduces costs to the system. Ooh. So the third area is communities, and some of you will, Debbie up there, Debbie sat at the front here from the Innovation Agency, and Debbie leads our programme of resident and patient involvement. And one of the things we've been doing over the last 4 years is reducing strokes. In our region, when we started as an academic health science network, we started thinking about what were the needs, because we're never going to get innovation or technology to stick unless we've got a real need for it. And we had a high incidence of strokes right across the region. So we scouted for the best technology out there, and we found some devices that were mobile AF detectors. So AF is an atrial fibrillation, an irregular heartbeat that can cause you to have a stroke. And we started to roll out detection using these mobile technologies. So the one you can see at the top being held and at the bottom by the firefighter is called a My Diagnostic, and it's a stick that you grab hold of either end. If you've got an atrial fibrillation, it'll give you a big cross, a big red cross. If everything's fine, it'll give you a big green tick. So really easy to use, very effective. You can see at a glance whether you've got an issue. We also use another device called an Alive Core, which goes on the back of a smartphone. I think Debbie's got one on her phone. You put your thumbs on it and it gives you a mobile ECG reading. So great use of technology. But this morning we've been talking about the people that we wrap around this. So what we found was we could detect atrial fibrillation, but when people got to the GPs, sometimes the GP was unsure about what to do next. How do we treat this? What support package do we wrap around with somebody that's got this issue? How do we help them psychologically, because they might be worried about the next stages, will they have a stroke? So we brought in an expert GP to work with the GP community around anticoagulation. And it wasn't all GPs. I just saw somebody shaking their head in the audience. Some knew exactly what to do and we were really grateful that we were doing this, but others just needed a bit of support and encouragement. So the firefighters at the bottom, we've got less people smoking, we've got less chip pans being used, so they've got less fires. So they go around doing safe and well checks in people's homes, and they're the familiar strangers in a community who people know and trust, and they trust them to do other tests. So they're rolling out our AF testing. When we tweeted this picture, it was our most retweeted tweet ever. People love a picture of a firefighter, so if you want to get a campaign going, get some firefighters involved. And we also have a cadre of AF ambassadors. So we have about 70 people who work with us to do testing in the community. And that model is being adopted across a number of academic health science networks. And we actually got the model from the Stroke Association, who have stroke ambassadors. So we've been borrowing something, it's getting traction, and it's making a real difference in our communities. And we've tested about 20,000 pulses over the last 4 years. And we think when you look at all the economic analysis of that, we've probably prevented 500 strokes across the region. So that's just sort of a quick whistle-stop tour on some of the activities of HSNs in digital and in culture change. And it really is all about connecting people, connecting sectors, breaking down barriers so that we can all work together and responding to needs of our communities to make a difference with digital technologies and cultural change. So that's my very short whistle-stop tour of some of HSN's work. You'll see at the edge I've just sort of put in a plug here for 2 products. One is My COPD, which is an app that supports people with COPD to monitor their conditions, have a peer network of people with COPD. It supplements what they're doing with the GPs. The GPs can prescribe it. It costs £20 a year, £20 for a lifetime licence, and at the moment NHS England are funding those licences. So a really good digital technology, but also one that's having one of the barriers taken away, which is a barrier of cost. The other one is an app that's been created in our region, which is a catch app. It's called the Common Approach to Children's Health. There's lots of C's in on this presentation, I've just realised. And that app helps new parents who they've got a new baby, they might not have family support systems or people they can talk to, and they don't know what's right for baby at what stage of development. So the baby might have red cheeks, they might not know that's about teething, they might turn up at GP surgery, they might turn up at A&E, or there might be something more serious. And the app just gives them an indication of what to expect at different stages of the baby's life. It's also customised for a region, so we trialled it in Cheshire, and it gave you the advice about where to go for a parent and toddler group, what support systems might be in your region, so it's really very practical. And the pilot we ran on this app reduced the guidance visits to A&E of new parents by 25%.